Even children who brush and floss diligently can't always clean the deep bumps and grooves of the back molars. There is a procedure, though, that can help protect your child's back teeth from decay, and it's simple and it's quick. Dr. David Richburg and Jocelyn Terrazas join us now from AOMS with more on dental sealants. Okay, so I had a dental sealant when I was a little girl, and I'm telling you what, it is, I mean, I think I've had one, maybe 2 cavities my whole life, so it's a good thing. And this is, I mean, it's a great way to protect your kids and kind of do preventative dentistry.
Exactly. So as dentists, we talk a lot about fillings, about crowns, things like that. Anytime we can talk about preventative stuff, we love to talk about it.
Okay, so talk about what exactly a sealant is.
So a sealant basically consists of a composite or plastic or glass ionomer, which allows for fluoride release into the tooth. Teeth have very deep grooves just naturally. Yeah. And so anything that we can do to fill those grooves so that bacteria, plaque, food can't get down into those grooves.
Some kids have deeper, and some people have deeper grooves than others, right?
Exactly.
And so if you're kind of susceptible to that, you're going to be more inclined to get cavities just in general.
Yes, and so that's where sealants come in. We fill those grooves so that food can't get down in there.
Okay, so why place one? I mean, its success rate is amazing, would you say?
Yes. We all know that brushing and flossing can clean the teeth, but we all know that kids are not the greatest at brushing, you know. Also, with the fact that they have very deep grooves on those back adult teeth, that's whenever the sealant comes in place, just because that plaque can sit in that groove for such a long time that it starts eating away at the tooth. So that's whenever we place the sealant, which has an 80% rate of preventing a cavity.
I mean, that's pretty excellent. Yeah. That's a great, awesome. That's very, very strong. Okay, and you want to do it when it's in the adult teeth, right? After the baby teeth have gone away.
Yes. Well, sometimes very small cases we'll put them on baby teeth, but generally once those 6-year molars erupt, that's when we're putting them on.
All right, so how easy is it to get one? You going to show us?
Yes, super easy.
So before we do that, real quick though, it takes less than 5 minutes to place them. We're going to show you it takes less than a minute. It's painless, which is awesome. A lot of people don't like going to the dentist just because of the fact you got to get your mouth numb. And so no injections, nothing like that. And then it's also really affordable. You think about the cost of fillings or crowns, they're very high. This is very affordable. If you can just prevent one filling, I mean, you can have all your teeth sealed, and it's more cost effective to do that than to get one crown.
Makes a lot of sense.
Okay. Super painless.
Okay, take us through the process.
So before we would start, we're not going to go through the whole process. This blue material that she has is an etch. Okay. It basically just cleans that tooth and allows it to bond, but we don't have the ability to wash it off now. So we put that on. Okay. Next, we would put on our bonding agent, and that's what allows the sealant to stick. So that goes on there. We would dry it, and then this is our light. It cures that, makes it hard, takes about 5 seconds for that. And then this right here is our sealant material. This is just for demonstration purposes. We put that on, put that in the groove, and then cure it again. And
that's it.
That's it.
Yeah. Now, would you want to do multiple teeth at once, generally, right?
Generally, if we have multiple teeth in the mouth, we'll do them all at one time, depending on what patients, how they want to do it.
And does it show up? It's clear, right?
We have the ability to do clear ones. A lot of times we put white on there just because so we can see where that sealant is.
And how long does it last?
It can last from 5 to 10 years, kind of depending on how careful the child is as well. Ice, anything that they chew on can pop them off. For most of the part, they stay on there pretty good. I've had some for 7 years now, and they're still there and going strong.
I love it. Okay, well, this is super interesting, and this can make a big difference, I think, for kiddos out there. So if people have more questions, they can just give you guys a shout, right?
Yes, definitely.
All right, at AOMS Pediatric Dentistry, we've got their website and all their contact information on myhighplains.com as well. Thanks, guys.
Thanks
that was
for
good.
having us.
It was really interesting. Stick around. We're going to head to the kitchen with Chef Bud.